Okay, I want to talk about actually the thing I want to talk about today is on Hector Politics is what happened in the of what happened with the earthquake, and they saying it's close to 1K people who passed away from the earthquake in Venezuela. That was news to me because it was shocking that that even happened. They're saying like I don't want to say death count, even though I don't want to even mention it. The death count, yeah, is close to 1,000. Yeah, let me look up Venezuela. Yeah, because those two earthquakes, 7.2 and 7.5. Yeah, the first earthquake it says was. Let me uh, let me show you guys this article. Okay, the earthquake. Two earthquakes happened at 6 p.m. their time. At 7.2, and then 32 seconds later, 7.5 hit their. Yeah. Yeah, the Caribbean plate near South American plate. Yeah, it says January 26th. Lawmaker Rodriguez says the death toll stood at 920, and 2,980 people were injured. Yeah, this is crazy. This is insane. Let me see if CNN said anything, but yeah. Oh yeah, they say close to 1,000.
The staggering jump in the death toll in Venezuela as we come up on 48 hours since Wednesday's devastating earthquakes. Authorities are now reporting more than 900 lives lost and hundreds of others remain missing. New video today helps explain why. This is from a drone over the state of La Guaira, right along Venezuela's northern coast, about 15 miles north of Caracas and some 200 miles from the epicenter. It's a tourist town to some, home to so many others. Rescuers believe people could be buried alive under those huge piles of rubble where many tall buildings once stood. Also, since Wednesday's back-to-back quakes, experts say there have been more than 300 aftershocks. That's, of course, only complicated any search and rescue efforts. Crews are calling this period the golden window. Within 48 hours, they have a greater chance of finding people alive. Tomorrow, at this same time, the chances of them being alive still dramatically plunge. On top of the desperation, there's also growing frustration. Residents are calling on anyone and everyone to help find survivors who might be trapped, and that help is on the way. That help is on the way. More than 800 rescuers are coming from around the world. The U.S. alone sending more than 300 people, but getting in for some can be difficult. Some airports in Venezuela were also badly damaged, including the very tarmacs pilots need to make a safe landing. CNN's Stefano Pozzebon starts us off with new video showing the impact of this mounting disaster.
Panic on board as passengers braced for powerful tremors. Just one glimpse of the chaos unleashed after two massive earthquakes struck Venezuela. This image from the public broadcaster Telesur shows large cracks splitting the tarmac at Caracas International Airport, underscoring the damage to critical infrastructure. Tens of thousands are still reported missing. Emergency teams are racing against time to dig through shattered concrete, listening for any sign of life. In the Caracas district of Chacao, rescuers pulled survivors from a collapsed apartment building, while others remain trapped inside.
We have rescued 3 people, and there are 3 more alive inside the structure. God willing, they will be rescued very soon.
As Venezuela struggles to cope with the scale of the disaster, international help is finally trickling in. But the logistical challenges to mobilize the aid remain. These relief convoys loaded with food and water are heading toward the hardest hit communities, as officials work to support tens of thousands of displaced families, while the priority remains to rescue survivors before time runs out. Stefano Pozzebon, CNN.
And our thanks to Stefano Pozman for that report. Let's bring in Nicole Cast. She's with the International Rescue Committee, or IRC, coordinating emergency efforts across the Venezuelan border in Colombia. Thanks for joining us. Let's start with the effort to just get into Venezuela. We've seen the damage to airport tarmacs and surrounding areas. How do teams work around that and get in there?
Thank you so much. Yes, it is an extreme challenge to get into Venezuela at this time because, as you've seen in these images that you just shared, the airport suffered significant damage and is not really available for humanitarian workers. So we're looking at the option of entering via other airports in other areas of the country that have been open for international flights recently and have opened additional routes, and also by land, although there are also significant challenges with that. That Venezuela still has a context of significant access restraints in which humanitarian workers have difficulty often crossing by land.
Doctors are warning of chronic underfunding in Venezuela, which has left hospitals unequipped to treat the surge of patients because of longstanding problems in that country. Do you see that complicating the rescue part of these operations?
Absolutely. We have to remember that Caracas is the center of the country, the capital, and also the place where all higher level or specialist health facilities are located. And so many of these facilities, including pediatric facilities and others, suffered significant damage, had to be evacuated completely. And that means that all of those patients are now looking for another place for support and help. And so the need in terms of health is significant. And this is one of the areas that the International Rescue Committee is considering in our response.
What do people in Venezuela right now need beyond those under the rubble who need rescuing, and how can people help?
Well, of course, in these first 72 hours, the priority is search and rescue operations. But as those finish up, our priority, and those are the larger humanitarian communities, really supporting people who survived. And we're going to focus on basic needs initially. Many people are displaced from their homes. A significant part of the affected area has suffered from structural damage, and so families are sleeping on the streets. And our own team, the International Rescue Committee's team on the ground, also is sleeping on the street these last few nights. And that means that shelters are filling up, and so people in those shelters need basic supplies. This includes hygiene supplies, and also supplies for specific populations, children, women. And so that's going to be the priority in the next few days. And then in the coming weeks, I'm sure we'll see some increased needs in food security, as many supermarkets and other places that provided food supplies also suffer damage. So we'll see an increase in hunger, which was already a challenge in Venezuela, a country that's suffering from malnutrition, and also additional health needs. We see that water and sanitation systems have been heavily affected also by this incident.
From a medical perspective, first of all, just tell us what you have been seeing, you and your colleagues have been seeing for the past 48 hours.
See, thank you very much for the opportunity. What we're seeing in our hospital right now in Venezuela with this catastrophe after the two earthquakes is a very difficult situation for us, because this earthquake caught us in a complex humanitarian emergency that we have lived for more than 15 years. Not saying for us, saying for the World Health Organization. So we are lacking of antibiotics, we're lacking of other important medical supplies in the urgency rooms and operating room that makes us very, very difficult to give to our patient a quite well attention in the hospital. Two of the hospital in Caracas has collapsed because the structure is very, very old and there's no maintenance, there's no do the things every well. So we have to send our patient to different hospitals in Venezuela that are almost in the same lacking of medicines that the whole Venezuela is going through the last 15 years. Most terrible thing that happened during this earthquake.
Yeah, and we've seen the scenes out of La Guardia. In fact, we're just playing some of them now on TV for our viewers. It's one of the most affected scenes, Doctor. And already I've reported from hospitals inside Venezuela. They have been, facing a lack of necessary resources for many, many years, as viewers will know. What is something of this scale, catastrophe of this scale, what does that mean for patients every day? Give us a sense of hospital beds, something like aspirin, imaging equipment. What do you need, Doctor?
Well, we need many, many things. First, we need water. We don't have enough water in the hospital for the patient, for all the things we have to do. We need antibiotics. We need anesthetic. We need even the sheets, paper sheets for the beds of the patient. We also need all the things. Of course, solution, intravenous solution. We are lacking all this before the earthquake, before the pandemic, before the blockade of the United States. So this emergency or this catastrophe faced us with all this lacking, all this with the collapsed healthcare system in Venezuela. It's very, very hard for us, all the medicals and nurses, to face this patient that needs all the things, and we don't have more than our willingness to help them in this situation.
Have you seen, Doctor, have you seen aid starting to trickle in? Are you starting to see some of those items of shortages you're talking about? Have they started to arrive yet, Doctor?
I think they're arriving to Venezuela, but the thing is, the health minister, there's no distribute these things with transparency. We don't know what arrived to Venezuela. We don't know where are those things that are coming from the international helping. So we don't know the medical person, all the medical assistants. We don't know where is all those help that is coming from international helping or aids to Venezuela. That's the problem.
How much? Yeah, indeed. How much trust then, Doctor, given what you've just said, do you have in the government of Delcy Rodriguez, who was part, of course, of Nicolas Maduro's team for many, many years? And I don't want to politicize this, but this is about, having a handle on a catastrophe of this magnitude. How much faith and belief do you have that this government, under Delcy Rodriguez, has a handle on this crisis?
Of course, we don't believe what they say. For example, we know till today that there was only 250 killed person, and now, because you tell us that almost 1,000 people killed during the earthquake. That's the problem, that they say one thing inside Venezuela and say another thing and try to see that the world that here all is okay. Here not all is okay. We haven't seen people, as you say in the beginning of the interview, the family is trying with the bare hand, trying to rescue the patient under the population. See that?
Yeah, it's very sad what happened to Venezuela. Oh my God, yeah. Yeah, prayers to Venezuela. Yep. You know, it's very sad.
There have been scenes of
BBC News. Yeah, there was a strike against Iran because some drones attacked the. Some drone attacked what did they attack? Drones attacked the boat, the Strait of Hormuz. Crime. I'm not gonna watch that. Yeah, so there was some Ukraine attacked Crimea. I just want, yeah, this is yeah, yeah. I just wanted to mention that. What else is there? Yeah, Iran. Oh yeah, I forgot. Yeah, I just seen this. Pete Buttigieg was yeah, they someone called CPS on him, on him and his husband. Crazy. I think I'm done. I'm done with my stream. So cheers everybody. I'm end of my stream. Just wanted to see the video of Venezuela, but yeah, just I'm end my stream. Cheers everyone. Everyone have a nice day. Prayers for the people of Venezuela. Yep. Hopefully the whole international community sends aid. Yeah, and Iran war is still going on. Seems like the ceasefire didn't go through. Yep. Yep. I'll see you guys. Bye. Like and subscribe to Hector's new Hector Politics. And subscribe to Hector Politics.